I am so excited today to introduce Dr. Veerle Van Tricht. And forgive me if I say the name incorrectly. Did I say it right?
Yes, that was very good.
Oh, wonderful. So I'm going to call you Dr. V just to keep it short, if
Yes.
that's okay. So Dr. V is an eye surgeon. She's also worked with Doctors Without Borders. She's worked as a surgeon and a speaker in 3 different continents, and she knows a lot about health and healing and burnout and energy work. So welcome, Dr. V.
It's my pleasure, absolutely, to be here in such an amazing group of being part of such an amazing group of people, as you say, of healers. I feel strongly that as a group we can make a difference for many more people.
Absolutely. And that's why we're doing this, is to spread our love and information and knowledge to be the difference on the planet and actually give people the tools without having to spend 10 years in college and thousands of dollars in coaching. So we just give it to them so they can start the healing journey themselves.
Yes, absolutely.
Well,
I love empowering people to take control of their health rather than handing it over to their doctors, because I see that a lot as a doctor, and the patients should actually also take more responsibility sometimes. So yeah, I'm all for it, to give people tools to take better care of their health and start healing. That's great.
Absolutely. So I know that you also, I'm going to backtrack just a little bit. Can you tell me what it was like working with Doctors Without Borders?
Yes, I was quite a young doctor. I was still in training as an eye surgeon when the opportunity fell out of the sky. There was this job in Cameroon where they needed an eye surgeon, and I was still very green or wet behind the ears, but I've always been very adventurous and I always loved discovering new places. So I just put up my hands and said, I'll go, I'll do it. So I got a very quick training, and then I ended up in the savannah and in places where people live in clay huts, and where the male nurse that was helping me, he had 4 wives to maintain. And it was a completely different culture. There was no clean water. I had somebody making food for me, but what I didn't realize is that everything was rinsed with river water, which was full with bacteria and worms that the local people were immune to, more or less. But me coming from a Western country, it was a very big attack on my health. But the positive part of I loved working in Africa. Actually, I've been in Africa for 6 years, and I felt I made such an amazing difference, because people came to me completely blind, like holding hands with a little grandchild who they use instead of a guide dog to walk them around, because they're completely blind from cataracts, for instance, which is a disease that we can cure easily with surgery. And when you do that, then the next day you check your patients, they're just dancing and singing because they haven't seen for years, and now they can suddenly see each other again. And it makes such a difference in their life. It doesn't only set their patient free, but also their grandchild can now go back to school, for instance, rather than being used as a guide dog. So it makes it was very satisfying work to make a big difference in people's lives. And professionally, because I saw all of these extreme cases, I saw a lot of trauma, I saw a lot of end-stage diabetes complications, and far advanced cases that I then operated on. It was the best learning school for me, because when I came back to Europe after that, everything was so easy, because in Europe, people get seen like at least when I work in Belgium, they get seen within a day almost after a problem, and they get operated really quickly, so then you don't have all the complications from long-standing disease. So it was a very good learning school for me, and it also made me appreciate how good we have it and how valuable our lives are, also seeing how other people live in very unhealthy conditions, like where people don't even have clean water and they just have to drink out of a dirty river.
So yeah, you know, that really
opened my mind.
Absolutely. That brings to mind, no matter how much, I'm living here in America, and even as a registered nurse, and I complain about the healthcare system here, and it's not the first time I've said it, where I don't even have health insurance. However, like you, I've traveled to a lot of countries and really dug deep to embed myself to be a difference on the planet right now, but we still have it so much better than so many people around the world, and we need to count our blessings and be grateful for that. So thank you for that reminder. And what an amazing woman you are. My heart, I got the chills hearing what you were saying, because not everybody has this passion to really get out there and be the difference. There's a lot of talking, but a lot of people aren't walking the talk, and that's what we need right now, is people who are walking the talk.
Yes, yes. I do often feel like a warrior a little bit. A lot of environments, when I arrive in the environment, I create a lot of change. And often I'm the innovator to bring improvements in a new environment. And I think that's why it's part of my sole purpose to move around the planet wherever they need me to go and implement some change and some improvement. It's not always easy for me to be the first one to do all the work, but I enjoy that part. I actually enjoy improving things. So, and then the people that come after me will have it easier, and then I move on to the next place. So.
A true trailblazer you are, for sure. Yeah. Now, you must have, well, I don't want to speak for you. Have you always had this deep spiritual connection?
Absolutely, yes. I don't know whether you know, but I wrote this book. It's a memoir, My Surgeon Talks to Angels.
Yeah.
And from an early childhood, I had quite a tough start in life, and I saw angels, and angels walked with me when I had to come home through dark streets, and I was attacked as a young child, and then I had a lot of fear, but I still had to walk the dark streets alone. And then I just prayed to God to come and protect me, and then an angel appeared, and that angel walked with me for several years. And I also, as a child, I remember saying to my father that this man visited me at night, and it turned out to be my dead grandfather. He showed me a photo, my father, and I said, yeah, that's the guy that I see at night. So I also saw spirits as a child. And of course, as most parents do, they try and say to your child, don't talk about things like that. And that happened to me too for a long time. Especially when I went to a convent school, and I got a bit traumatized by the whole story. Well, with the way people were acting in the name of Christ, God was not always as loving as I wished. So, but then when I started as a medical student to work in hospitals, I started feeling the presence of angels again, especially in the rooms of people who were about to die. And so I volunteered in intensive care as a nurse, actually, during my first years in medical school during the holidays. And I was working in the intensive care unit where a lot of people are on the verge of dying. And that's where I first felt that energy again of there's a presence in the room more than just this person. And it's not a negative presence, and I can feel the difference. So then I started talking to some people, and there were more nurses that said like, oh yeah, we also feel that, or we also see that. So I thought like, wow, I'm not crazy. There's more people who have these experiences.
Yeah. You're not crazy.
I started reading more about it, and then I did the angel therapy training with Doreen Virtue, and now I feel very confident. So confident that I've developed my own angel school.
Oh, that's amazing.
Yeah, because there are a lot of people who could benefit from this positive, benevolent energy that's always around us, and a lot of people don't use it, especially carers and people who are on the verge of burnout. They can ask for these spiritual helpers to come and surround you and lift you up, and
right. And it's so, yeah, and it's so needed. And you know what I love about your message, and I'll share it a second something similar that happened to me also, is that, you know, at one time we would hear people speaking about angels and helpers and energy, and now we know it to be, you know, quantum physics and energy, and, you know, a very thin veil. But I love the fact that so many professionals, doctors, nurses, educated people, PhDs, are actually speaking about this freely now, because that destigmatizes for other people who maybe don't have that training, and makes it more real for other people to understand that, yes, we're bridging the gap, you know,
Yes.
we're rising in consciousness. And I love what you said about angels. You triggered something in me, and I didn't know I was going to be bringing this up on the summit. When I was a child, I was sexually abused for many, many, many years, just horrific abuse. But people have asked me years ago in therapy, what was the one thing that helped you get through it? Aside from disassociating from my body, but that's a whole other journey. And what I tell them is the honest to God truth. I saw 4 angels, huge angels, one on each mountain. And they told me, Niki, no matter what happens to you and no matter who touches you, they're never touching the essence of you. And you are loved, and we are here for you. Gosh, I'm going to cry. And that has stayed with me my entire life. And I've always been contacted, but I didn't know it was from angels. I knew it was an energetic force and energy field. And like you know, I tried every religion, from being a holy roller to being a Buddhist to living in an ashram in India to everything, before I became balanced in universal love and consciousness.
Yes.
So I love the fact that someone like you, with all your experience, is sharing this to the world, because it's so needed. So needed. How do your peers or other medical professionals react or respond, other surgeons, other doctors, when you tell them how connected you are spiritually to the other realms?
Yeah, most surgeons and doctors, they kindly don't talk about it. But I know a lot of the nurses I work with have read the book, and they're fans, and they have similar experiences. And we've even implemented these changes in the workplace now, where I have convinced these people it's important that we as carers have a high vibration when we deal with our clients or our patients. So there's no gossiping while I'm doing surgery or something. They have to be all paying attention to, you know, from our heart to helping as much as possible. We need to be in that right vibration energetically. And the ones who read my book, they're doing it. And I love working with people like that. I mean, if I prefer to work with a team where we're all on a higher vibration of, we're coming in because we're doing our sole purpose, which is to help these people in a loving way, in a positive way. And I know that the surgery will go better that way, and also the patient will heal better, and they will be less stressed. Because often when I have a new anxious patient coming into my theater, I will call in angels so to please come and fill the room with your peace and calm. And then the patient relaxes and they say, oh, I didn't feel a thing, and it's already over. I mean,
That's beautiful.
it's amazing the difference you can create just by calling in this higher vibration, and how it lifts everybody up, even though they don't know what's happening.
Absolutely. You know, I was listening the other day to Bruce Lipton, who's the molecular biologist, and he was explaining how we used to think that, you know, the atom, that it was a tiny, dense particle of physical matter. And obviously now they understand that it's like a little tiny tornado, a vortex of energy. And so I love that visual, because when I expand upon it, I can actually see our whole physical body is just energy. It's little swirls of energy, and energy interacting with other energies. And this is how we create. And, you know, people call this new age, but it's not. This is ancient. This is since time immemorial. And now people are just waking up consciously and connecting with that. And the fact that you're performing surgery using this energy and connecting to source, and that you're empowering the other nurses and the staff with you in the surgery room. You called it a theater? Is that what you call
Yeah, that's the word we use in England.
it? It's cute. In the theater. Because actually it is. It's
Big
life.
show.
Yeah, it's a big show. Life is all the world's a stage. Absolutely. And that's how we are changing the planet. That's how you're changing the planet, is by showing and leading by example.
Mm-hmm.
Leading by example. I so love that. Do you see healthcare burn? You've practiced in many countries. What's the difference in the way that people burn out, or that you see people burning out, or they're about to burn out, like in each country? Can you break that down? It's a tall order.
That's a very, very big subject, because burnout, there's stressors on your individual, and it depends. Certain personalities can take the stress better than others. So A-type personalities have a higher risk of burnout, for instance, and a lot of doctors and nurses are especially surgeons. There's a lot of A-type personalities. Why they also burn out? Because they're too proud to ask for help. They don't want to admit they have a problem. They're scared they're going to use their license if anybody finds out that they're depressed and maybe drinking too much or something along those lines. So there's a lot of suicide, sadly enough, in amongst high performers. Right. Actually, it was an American study by the Center of Psychology. They found that half of the people in healthcare that work in healthcare were burned out, and 36% were depressed, and 6% had suicidal thoughts. So that was an American study. So it's definitely very common in the States, because you guys get a lot less free time than we do in Europe. And me time is one of the things that I advise people to get when they're on the verge of burnout, just to prioritize time for yourself. And because if you don't get out of bed in the morning because you're too exhausted, then you're definitely not going to be there for your patients or for your clients or for your family. So that's one of the main messages I want to give people, is that they need to put themselves first. Absolutely. And that's hard for carers, because they constantly give to other people, but they forget that's like their energy tank is empty. They need to take time out to go and give themselves caring, loving energy. And you can do that in many ways, like connecting to nature, or getting a massage, or having a break from work and doing something that makes you extremely happy. So there's lots of ways to do that. And I also teach people how to build that into every day, so that you get a more balanced life, where you're not only giving, but you're also giving to yourself, or receive something that nurtures you. Because you can't run on empty. That it's like a car, it needs gas or electricity to keep on running. So
and that's what I'm finding. Not only, I mean, I had such an extreme burnout myself, but I see that in healthcare, and doctors and nurses that I'm speaking to are telling me I'm getting out. I can't even handle it anymore. I don't want to practice anymore. And there's such an overwhelm. And at least here in America, a lot of nurses and healthcare providers, if they don't work for 3 weeks, like that's it, they're homeless. Like the argument is, I can't afford to take any time off. I'll lose everything. And sometimes, sometimes that's a choice that you have to make to save yourself, because when you're rejuvenated and you save yourself, some higher calling is going to step into your life, and you're going to use that and create something even bigger, but you may not be able to see it now. And if that's what the choice is, that's what I had to look at it. Like, it's either me or them, and either I'm going to die and my life will be meaningless and I won't be able to help anybody, or I need to get it together. Yeah. And I love what you say, because it's like a shame-based dirty little secret in the healthcare and the medical profession, that we're so exhausted and so burned out. What are we actually giving to the patient who really needs us if we're not present?
No, there's very little giving anymore. I mean, I had this conversation this week with young doctors who say, like, we stepped into the profession, and I was the same, because I really wanted to help. But circumstances are that we don't have enough time for our patients to really have a bond and a connection. which I want to have with my patients, but I don't organize my work schedule at the moment. And the people who do just think about how can we make this doctor see as many patients as possible per day. And I can't always deliver the care that I want to provide. And that makes me very unhappy. And that creates the ideal place for burnout if you're not happy at work. It's one of the factors, the risk factors that I found, not being happy at work, not having enough sleep. And it then creates problems at home with your relationship. And it's a very holistic problem. And that's why my solution is also very holistic. And I'm glad you mentioned connection with the higher consciousness is something I teach people, especially, and also to find their life purpose, because when they can get passionate again about what they do, then that is an energy that can, and if you're on track with your life purpose, you will get more energy.
Absolutely. And you know, that burnout, that resentment, I don't remember where I heard this, and it snapped clear as a thunderbolt of lightning, that it's a resentment when we're not living our life purpose, when we're not happy, when we're just working and working. And, you know, ICD codes, I don't know if do you deal with ICD?
Similar, not as bad as you.
Yeah, you know, you have to find a code for every diagnosis, and everything is so much paperwork that you don't actually have the time to work with the patient. And they see this, they see you running around, and they're thinking, I'm sick, I'm hurting, I'm dying. Like, what about me? And we know that. And then it weighs on our subconscious, because we go home knowing that they were reaching out for us, and we had to keep going because we have to keep our job. And it's a really sick system. And I see that that's why a lot of health practitioners are branching off from that and creating their own businesses, which is amazing. And it doesn't even involve insurance. And I find it's even less expensive just maneuvering the system that way versus paying these high premiums. I'm not saying not to, I'm not making a statement either way for anyone else who's watching. So
are not getting the care they need. There's also heaps of statistics that show that exhausted carers, doctors, nurses, or other carers, make mistakes. So they make medical mistakes, they have more car accidents, things go wrong. I know from my own experience, if you are exhausted and you get 3 questions at the same time, there's bound to be a moment where you make a mistake. So it's dangerous. It's not good it's not safe for the patient, and it's not safe for the doctors or the nurses either, because we already know the negative consequences burnout has on health if you don't jump out of that. If you don't get help, it leads to depression, suicide, lower immune system,
it does.
So there's so many negative consequences and I prefer prevention. I would really like to get involved in how can we change the health system in a way that's healthy for doctors as well and nurses, as well as for the patients, where there's one-to-one contact. And it's completely going in the other direction. I was thinking about this week. When I was a child, I went to the same family doctor who knew me, and I knew the person, and there was a relationship. But now I just found a new doctor here, because in England you have to go through a doctor before you can get anything done. I can't prescribe for myself. I don't know how that is in the US. But this person, after 2 visits, he said to me, I feel uncomfortable being your doctor because I am your friend. Now, actually, he's just my neighbor, and I've maybe spoken to him twice. But he's uncomfortable because we know each other. How crazy is that? It's the opposite of what I envision. I actually want to know who I'm dealing with, and on a holistic level, I want to feel their energy. I want to know their history. I want to help them with their current problem, with their future. I mean, I always look at the whole patient and what's their family, what's going on in their life, what's going on in their family. It's all important for me. And And the way medicine is going now is they put everything in box. They put every person has to fit in a certain box. And then if once you're in that box, you get that test and that treatment, but they don't never consider the individual anymore.
Right.
I absolutely dislike it. And I'm sometimes a patient myself. I don't like it at all. I don't want to be part of a protocol. I'm a human being, and I need some say. Actually, I feel also takes the power away from the patients to put them in a box and say, this is where you will go and you have no say.
And we know that that's just all about money. It's just all about money and insurance companies. And we know what the problem is, and we know we're not going to change that. But how we are changing things is exactly as you're discussing, as individual healthcare practitioners are just branching off and starting their own businesses away from that grid and creating a new higher vibrational grid, which I call part of the matrix. And isn't that what conscious evolution is about?
Oh, yeah, I'm there already. Can't wait.
I love that. I love it. And imagine when we integrate that. I mean, it's already happening. It's already arising on the planet right now because people's souls have been requesting this, and we are conscious and evolving to higher levels to create new paradigm shifts on the planet. Yeah. And the more we speak out, and I love that you're a trailblazer, the more we speak out, the more like-minded people are going to join with us, and we keep connecting higher and higher. We're already doing this with women's movements all around the world, and women sister circles, like lifting each other up and helping each other and elevating each other. Not to leave, not to leave the masculine out, because it's a balance of everything and everybody, but we're all rising together, and I love that. And that's what healthcare needs.
Yes, absolutely.
Because how are we going to change anything if we can't even take care of ourselves?
Yeah.
So I'm discovering, and most of the experts that I'm speaking to, looking at burnout is, thank God we burned out, because otherwise we wouldn't have stopped and said, whoa, what's the solution? I can no longer live like this. Thank God I burned out. So it's like a play on burnout.
Yes, absolutely. And luckily they didn't die, because some people with burnout won't make it, I'm afraid. So the ones that jumped out in time of the training time before it crashed, they're the ones who are still here. And yes, then you can see the blessing in it, because it forces you to take time off and recalculate whether you're still doing what you want to do with your life. And is this the way you want to work? Is this how you want to live? Is this what you're doing? Is this good for your health? So yeah, it is great. I definitely have realized when things like that happen, it makes you think, and it's an opportunity for change.
Absolutely.
Yeah.
Absolutely, opportunities for change. So why do you think that we are even here on the planet, and those of us who chose to go into healthcare, why do you think what was the real message that we chose healthcare as a profession?
Ooh, I mean, when I was born, I already picked up a lot of lost animals as a young girl. I found a lot of lost animals who were half dead, and I held them in my hands, and I revived little kittens and birds and whatever. So I felt like I was definitely born with a healing energy, and I care, and I really value life. So
I get that. Yeah. I did the same thing, even though I grew up in foster care and group homes, and I was on my own basically my whole life. I used to volunteer in convalescent hospitals when I was in elementary school, and now that I look back on it, I'm in my 50s now, I'm thinking, I don't know any fifth graders who would go volunteer in a convalescent hospital to help 80, 90-year-old people clean themselves. Like who does that? So this is obviously something that I think we're born with. And those of us who have gone through other particular traumas at a young age, I also see that we use this as a way of wanting to save other people from going through pain that we took on ourselves, and we don't want them to go through the pain. And a lot of us get lost in codependency and try to save everyone else and put ourselves last until we do wake up one day to this extreme burnout. And that's when we have to deal with our codependency issues, deal with the traumas that happen, face them, face the shadow side, do the inner work, because you know what? We can be aware of what's happening in our life in the healthcare profession and working with patients and others. But if we haven't healed our own inner wounds, yes, we may be helping them, but we could be helping them so much more if we weren't projecting onto them our wounds.
Yes, absolutely. Yeah. That's why part of the work I'm doing now, I love it so much, because it's about healing, as exactly as you say. It's called The Journey, where I've become a practitioner, where I can really find people's hidden traumas and find emotions that are stored in the body that are causing disease, and bring them to the light, and then do a whole healing process and forgiveness. And it's amazing, people with back pain or neck pain or shoulder pain, after one session they can be free of pain, because sometimes it's just your body talking to you about, oh, you really should be looking at this thing that happened 50 years ago, or and then release that and heal that. And it's wonderful. And I get a lot of criticism still from a lot of people when I talk about the importance of your emotions on your health. And they've accepted for a long time that there's an emotional origin to heart disease, which is probably more important than cholesterol. Then and people are, when they're angry and then they get a heart attack, and there's definitely emotional causes for many, many illnesses. And again, I would like to be preventative in that. So ideally in medicine, we should stop these emotions from settling in somebody's body and causing a disease earlier on by doing this actually emotional health care.
Exactly.
Healthcare, yeah.
I love that phrase, emotional health care. I've never heard that before.
No, I just came up with it now.
Oh my gosh, emotional health care. That is so true. That's what you should name it. Emotional health care. I love that.